You're about to listen to Julie in Genderland. The whole series is available to download now, wherever you get your podcasts. Please listen, like and share. My name's Julie Bindel. I'm a feminist. For 40 years, I've been campaigning on the issue of men's violence against women and girls. Now, a new front in that battle has opened up in the form of extreme transgender ideology, which says anyone can change sex. And men are women if they say so. And somewhere along the line, children have been caught up in this insanity. In this podcast series, I'm talking to some of the handful of brave individuals who stood up to this nonsense from the start. One of the professions where voices of sense in this debate were conspicuous by their absence was psychiatry. So thank goodness for Dr Az Hakeem. So when were you first called transphobic?
2000. Yeah. But never by a patient. If you Googled me, there were 13 pages of Google about how I was the most evil, dangerous, transphobic, homophobic psychiatrist in the world, and the 13th page was in different languages.
Welcome to Julie in Genderland.
So I'm a consultant psychiatrist, and I'm unique in that I'm the only consultant psychiatrist who's specialised in treating adult gender dysphoria with psychotherapy, and I've done that since 2000. I trained as a psychiatrist, then I did higher training in forensic psychotherapy at the Pullman Clinic. And the Pullman Clinic is a specialist psychotherapy analytic clinic for anything to do with sex, gender, perversion, violence. And within that, specialised in gender dysphoria because I was always interested in it. So when I went into medicine, I came from a very arts background, and I thought, gosh, sex changes are the ultimate piece of sculpture. And my first job as a doctor was as a house officer at UCH in plastic surgery. And I used to help, emphasis on help, not do, help the sex change operations. And I thought, okay, sculpture-wise, this is amazing, but what on earth's happening in their head? And then the surgeons, just like being master craftsmen, they didn't know what was happening in their mind. They said, well, the psychiatrist said it was okay. So then I did psychiatry, which I'd always wanted to do. And the psychiatrist didn't seem to know what was happening in their minds either. So I went to the Pullman clinics. I wanted to do analytic stuff and psychotherapy, and there was this clinic where they had one trainee, and they said, well, you can do whatever you want for 5 years. And I thought, oh, let me start doing this gender dysphoria stuff. I think it's fine, yes. And I got into that one, and I realised that nobody was thinking about it.
What year was this?
2000. And so I inherited a group that was already being run by someone retiring for pre-operative transsexuals and one for post-operative ones who were miserable. And I took them over and I combined them, and that was the start of it. And I was doing that until I left the NHS in 2012, writing academic papers that nobody reads. Nobody knew what I was doing. It was only when I joined Twitter that I started writing about it. All of a sudden the whole world knew what I was doing. We wrote a letter in the Telegraph, that's right, when they got gender recognition. That was like gender recognition.
In 2004?
Yeah, so we wrote a letter to the Telegraph, myself and all the other consultants at the Portman, saying this was a triumph of fantasy over reality. And the Tavistock switchboard got jammed with complaints, and Tavistock were going, what on earth are you doing? You didn't ask permission to write this.
I remember it well because it was 2004 when my hell started with the article I wrote in The Guardian. And actually there were many of us saying, but this makes absolute sense. Of course they're right. And of course there wasn't the lobby then that was so organised as they are now.
Whenever I've talked to anyone, they initially think, oh my God, how can you think that? They're born in the wrong body. And then once you talk to them, they realise that actually you're speaking common sense and that nobody's actually trapped in the wrong body. It's just a misunderstanding of the person's part that has then been colluded with. And if you track my writings, my first papers were, is it mad? Are they mad? And I answered, no, they don't seem to be. And then I moved to, no, they're not mad, we're mad. So it starts off with an erroneous way of working out oneself in the world, usually in a state of autism, that then has a mad response by society which colludes with their false solution. So it's the emperor's new clothes. So everyone is politely going along with something, colluding with a false solution, And I say that it's a non-solution to a non-problem, because the actual problem is something else. Like with men, it tends to be autism and I don't feel quite right. With women, it can be trauma, internalized lesbophobia, whatever it is. But the solution they get to is I'm the wrong sex. And then to that, we have this collusory, affirmatory madness that we go along with something that we don't really believe, but we go along with it. And if anyone dares not to go along with it, then they're bad. So we're mad, they're bad, but the actual original person came to the wrong conclusion. It's like me in my maths A level. They give you a complex maths equation you've got to solve. I thought I got the right answer, but somewhere I'd made one step wrong and I ended up over there. Just the same, you've got this autistic person who's going, okay, there's something different about me, not quite right. And then they have this idea, oh, maybe I'm the wrong sex. And then they hone in on it and everyone goes, oh, there's your wrong body. And that's how you get the evolution of gender dysphoria.
It's really interesting the way that you talk about coming from this background of fine art or having this fascination with sculpting and creation. Because I remember a long time ago, before social media and before this became a thing, being fascinated with those that were doing body modification for art and thinking, what? I mean, really extreme. Fakir, I think his name was the most famous one, who sculpted his waist to about 6 inches and was hanging off hooks. And then there was the woman who had implants into her head. She's a very notorious body modification artiste and had bull's horns and the like. And I remember thinking then about how people use their bodies as some kind of template and then coming back to it later. Because of course that was always part of gay male culture, clubbing culture as well, tattoos and the like. And then we end up where we're not just giving permission to children as well as adults to carry out or have extreme body modification upon them, but we're celebrating it as affirmation. When did they start, do you know, referring to sex change surgery as gender confirmation surgery?
It was surreptitiously morphed into it, wasn't it? And what you're saying about the body, using the body as a template, I used to run a service for severe borderline personality disorder. There were mainly women, and a lot of them had histories of horrible sexual abuse. And their response to it, consciously, otherwise, or somewhere in between, was to make their bodies such that they felt that they wouldn't want to be abused. So they often became very large. They were covered in self-harm.
Yes.
They didn't want to have bodies that people would want to do things with. That was their self-protective mechanism. And when you look at some of the photos you see of people who've transitioned, there's a bit of an overlap. All these scars, and it's often quite shocking in the same way that our patients' bodies were shocking, and there's probably an overlap. But like you said, it's celebrated, and I'm not sure why we're celebrating it.
Right, because if you look at women's prisons, and I've spent quite a bit of time interviewing and talking to women in
I
prison.
worked in Holloway.
Right, so Holloway's a good example of that, where there was a woman called Josie O'Dwyer who'd had that horrible history of extreme sexual, sadistic violence from her father, very brutal home, endured yet another rape, ended up in prison for fighting back against that violence, and was repeatedly self-harming. In the end, she did take her own life, but she would hack at her breasts and at her genital area.
Usually starts off in arms and wrists, and the more severe, they're doing their genitals and their breasts. And it's not too dissimilar from people want to hack them off.
And that when we say this and when we use the term mutilation, or when detransitioned people use the term mutilation, because of course they have absolutely every right to describe what's been done to their bodies, they're told, well, it's false consciousness, you're just internally transphobic. So what chance has anyone else got to describe this brutality against the body?
And what I find horrific is that you get parents who are fighting for their children to have bits chopped off. It's very strange parenting. Then you get parents warring because one parent does and one parent doesn't. And I mean, I suppose all parents want the best for their child, and if they think that actually what the child is saying is true and that this intervention is a treatment that they're led to believe, then you can see how they want to fight for it.
Yes.
But you do wonder why they don't dial back and think, can my child really be trapped in the wrong body? Because we all know they can't, and it's not the case.
Well, some of the statistics that have really shocked me, because I keep thinking I can't be shocked, was from a couple of years ago when the numbers of referrals to the northern GIDS were made public, and the spike, the highest number of referrals of girls who were same-sex attracted, was from Blackpool, not Brighton, not where you would expect, but Blackpool. And of course, these were girls, many of whom were autistic, shockingly high number, many of whom had self-harmed, pretty much all of whom had been neglected or abused within childhood, sexual abuse, rape, captured into grooming gangs, the whole lot. And somebody said to me, but how on earth can it be Blackpool? I mean, that's not Brighton, that's not the kind of upper middle class elite. And I said, yes, but what do these girls all have in common? They all have a social worker. And that was the glue that held this together.
A well-minded social worker who thinks, oh, yes, because part of borderline emotionally stable personality disorder is an uncertain sense of self, identity, gender, sexuality. If you've got this sort of emotionally dysregulated, chaotic, self-harming, not happy with their self, and uncertain about their self, all they've got to do is state this uncertain sense of gender, then you're jettisoning down this pathway for this non-problem. It's a symptom. I've always said that gender dysphoria is a symptom, it's not a disorder. It's like a cough. If you have a cough, you might have something stuck in your throat, you might have a sore throat, you might have a bronchitis, you might have lung cancer. It's a symptom. So anyone saying, I feel like my gender is wrong, is a symptom like a cough. It's not a disorder. You can't just say, okay, everyone who has a cough, we're going to remove your lungs. And all I did in my therapy wasn't that complicated, I don't think. All I did was say, okay, fine, so you're not happy with your sense of gender. How did you, and trying to see how they got there, they're working through. And inevitably you'd track stage by stage how they got there. And you could see how they got there, but it was like me and my maths. They made one step wrong and they'd ended up over there. And often, what I found with my adult patients is they might have come to this conclusion when they were 12. And when they were sitting in front of me as a 30-year-old or something, I would invite them to go back and show me their reasoning, which they hadn't gone back and thought about again since they were 12. But with their adult brain, they could see how their 12-year-old brain had come to some erroneous stages along the way. They would then question their own conclusion. And it was only by getting people to try and help me understand how they got there that they could then, with their adult brain, see that. And when I was seeing them in groups, they could see in each other resonances, similarities and identifications, but then they'd be able to challenge it. And it was only by doing that eventually, by being in the group, their gender dysphoria went. So I wasn't doing any conversion, I was helping them think as a group, and by them all thinking together, they resolved their gender dysphoria each other. So were they doing conversion therapy on each other? That doesn't make sense because they're all coming with a sense of gender dysphoria. But it worked. And in the 20 years that I was seeing patients, in the survey I did after 12 years, less than 2% did any physical interventions. Those 2% said, I know I'm never going to become a man or woman, whatever it was. I'm just going to be a trans person with whatever it is. I'm not going to pretend to be male or female. And I know it's a bit mad, but I will. And they have this much more reasonable, rational, thought out plan rather than something that was otherwise that you often see. And most of the patients just said they were happy with who they were. And
you were the first clinician I ever heard say that for many kids, for many young people, of course, same-sex attracted are overrepresented.
Totally.
You actually referred to it as a modern-day conversion therapy.
Yeah. I was at the GIDS very early on, and I couldn't keep my mouth shut. It was just horrific what I was seeing. All I could see were children who'd just be gay. They were like camp boys and tomboy girls. And I remember saying to the person who ran it, I said, well, aren't you just, isn't what you're doing mad? Won't they just be gay? And he said, what's more mad for them to be homosexual? It was typical of the clinic, it was typical of the Tavistock, which is embedded in homophobia. This was only 20 years ago, and I remember at the Portman Clinic we had a referrals book, and you look at the referrals and they might have been referred for something, but the reason the Portman took them was, and you see them sort of, referral reason, lesbian, gay, and so there was, and I was taught 2 terms at the Tavistock in the adult department, 2 terms on the pathology of homosexuality. So if you have a service which is going to change children into trans heterosexuals rather than otherwise being non-transsexual gay people, then it was a weird solution in that context.
This is extraordinary. I remember looking at Iran, because at the time, back in 2007, when I did a Radio 4 debate called Hecklers about this issue, I wanted to look at where the highest number of sex change surgeries were carried out, and it was Iran. And it was for the reasons that you've just set out. And I was debating 4 trans activists. That's the nature of the programme. It was called Hecklers. You say something controversial like the Iraq war was just, and then you have everybody kind of throwing their arguments back at you. And I remember when I said this, but why then, if this is progressive, if this isn't conversion therapy, why is Iran doing the highest number? And not one person answered me. They were allowed to just skip over that question, but it's key, isn't it?
Oh, totally. Yeah. I mean, GIDS invented the child, well, they didn't, but they were a big proponent of the child gender. And if you listen to the woman who used to run Mermaids, if you listen to her publicly available YouTube and TED Talks, she doesn't beat around the bush about how her son was quite camp and she was worried about becoming gay. I mean, unless I've misheard this completely.
Well, she was very clear. She said her husband didn't want a gay son. He had a huge problem with his son playing with toys that were sex stereotyped to girls. Yeah. So what's that if it's not homophobia? And I'm just wondering about how you manage to reconcile being involved in a profession which looked at gay people, at same-sex attracted people, in the way that they did.
It was a bit like being in a mad family. I was always very outspoken about what I thought was nonsense and ridiculous, and I've always been a bit of a troublemaker that way. And I'd always say, this is ridiculous. But I suppose it's a bit like growing up in a family where you don't listen to your parents and you just do what you do anyway. So I would take on what I thought was sensible and reject the rest. So yeah, I may have been working in an institution with a homophobic culture, but I was working my way. So that didn't really matter.
So can you offer any explanation as to why GIDS, or gender clinics in general, are seen as these places of freedom and progression and pro-change and difference, when in fact they're obviously the opposite? I mean, it's an ideology that's rooted in deep sexism and homophobia, isn't it?
But the irony is that Stonewall have hoodwinked what seems like most of the gay and lesbian population into supporting this in this sort of very culturally self-harming way, and that you've got the gay, they've been hoodwinked into believing that they're LGBTQ and that they're all the same. They're all completely different, but they've indicated the word gay. So BBC, ITV, they will not even use the word gay. You're all LGBTQ. I'm sorry, which do you mean? Why be so non-specific? I know you mean gay, just say gay. There was somebody set up on Twitter a Yes Cymru BAME group, which is a group for Welsh nationalists, for Welsh independents who are funny coloured. So I joined because I'm Welsh, I don't sound it or look it, and I'm beige. So I joined it, and there was only 8 people in this group on Twitter, and I was the only one who wasn't white. And then 3 of the people in the group were saying, oh, hang on, we've looked you up. We don't want your sort in the group. And then someone's going, you can't say that. He's a minority ethnic. You can't say that. He said, no, but he's a transphobe. And they're going, I said, hang on. A, I'm not a transphobe. B, I thought this was about Welsh independence. And they're going, yes, but we don't want yours. So I actually got kicked out of the Welsh independence BAME group as the only non-white person because they thought I was a transphobe.
And people say that this isn't knee-jerk identity politics, without the politics, of course. It's really extraordinary the way that, first of all, the so-called gay community, of which there isn't, has just been completely colonised and co-opted by heterosexuals with a kink. But secondly, with children who should now, in 2024, be able to come out without facing stigma, shame and bullying and the like, as I did when I came out in the 70s, and now being diverted if they've got parents who are upper middle class liberals, or if, like the Blackpool disenfranchised girls with social workers, are being somehow diverted into a gender clinic. My view is that we shouldn't have gender clinics.
But teachers are being trained to spot them. So I've had friends who said that their friends have gone to school and their 8-year-old daughter, who's a bit of a tomboy, was approached by a teacher who'd done some course, obviously with Stonewall, and said, oh, do you think you should be a boy? And the girl was saying, no, I never thought I should be a boy. And they're going, because you like these boys' things. So it was almost like grooming on an educational scale. A girl who's just tomboy was identified by teachers having these characteristics and then taken to one side and introduced to the idea that she could be the wrong sex. I mean, that's a bit messed up.
Now that GIDS has closed and we've got the CAS report, why are we hearing talk about other gender clinics popping up? Why do we need gender clinics? What are they?
We don't. They're a way of not allowing children to have proper treatment for their complex mental health conditions, but instead just giving them a false treatment for something that's a non-problem.
So what's going to happen, do you think, in the future when young people who have been groomed into this fantasy scenario are going to be told, no, you can't have puberty blockers. No, you can't be put on a waiting list for testosterone or whatever. And they are obviously used to lots of attention. Perhaps they've developed narcissistic traits. Either way, they've got huge problems.
Because I've always said that there's a massive correlation between gender dysphoria and autism. And what we see in autism is this concept of autistic meltdown. So, for a child, it might be my baked beans are touching my fish fingers. They have this massive meltdown. It's totally out of proportion to the actual situation. And when you see all these videos of people just screaming in universities because they don't like the debate, it's an autistic meltdown. So it's the same as the baked beans are touching my fish fingers. So if you don't give me what I want, I'm going to scream and scream like Pippi Longstockings.
Yes.
You know? And that's the autistic meltdown. So what you're seeing are these people at university think, oh, they should not be at university, just having these childish autistic meltdowns, thinking that that's a way of winning the argument, to scream.
And what will happen though, because they're going to be angry kids on top of the autism, the narcissism, the huge myriad of problems that they had which led them to believe they were trapped in the wrong body. How are we going to pick up the pieces?
So you treat them for the distress, the anger problems, the depression, all the psychological stuff that may or may not happen, you treat that. You don't just give them sugar. You give them a balanced meal. So whatever the situation, and they're not going to kill themselves. That's the false narrative that mermaids and Stonewall like you to think there is. There is absolutely no evidence to suggest that there's an increased rate of suicide in gender non-conforming children if you don't, castrate them. There's no difference, and that's a false narrative. It's a myth that's being perpetuated. And it's almost like another form of grooming, but at a parental level. If you don't do this weird, strange thing to your children's genitals, then they'll get this awful thing happening. And they're treading this fine line of, I want to be reality-based, but I don't want my child to disown us. So,
or kill themselves.
They're not going to do that.
No, but what I mean is that somewhere we internalise, we believe on
The
a
sensible
level,
parents know the child won't, but they worry about them just cutting them off and divorcing them.
which is what many of the parents I've spoken to have said to me, that they are clinging on for dear life because otherwise they'll lose the relationship with them completely. And then that will be it. And some have, of course, lost the
But it's
relationship.
a bit like, so the scary thing I had was I had a parent as a patient who came to see me, and she was very sensible, gender critical, reality based, and she was saying how, you know, she didn't want to give her son money just in case he went and bought these hormones and things. But then maybe he just turned 18, but he took himself to a gender clinic, a private gender clinic. There were no psychologists, no psychiatrists, it was a surgeon and someone who prescribed hormones. And on day one, he was given a loan so that he could have future appointments. And he was also told that he could have a loan from the clinic for the surgery, which he could then pay back with interest. And it's a bit like some sort of weird drug dealer type cartel where we're going to give you what you want and here, have some more and you can pay us back later.
It's completely that. And you say that this young person had an appointment with a surgeon, not a therapist? Or
No, there's no psychology in the clinic.
I can't quite get to grips with how much worse this is even than it.
And it was awful, yeah. And then in the private sector, I had a patient who was seeing me for therapy. And he said, oh, can I also be referred to a gender clinic? So I said, okay, fine, I'll let them do that. They can do their bit, I'll do my bit. But the whole time he was in therapy with me, the gender clinic didn't write to me once. They didn't ask me anything. There was no correspondence. I would write to them, they wouldn't write back. And then at some point they gave him a sex change. You'd think they'd ask me, as the psychiatrist looking after him, whether I thought it was a good idea, but no. Turns out it wasn't a good idea. You think, what sort of medical good practice is this? If I refer someone to someone, I'd quite like to have some sort of communication with the other person as to how they're doing, what thoughts they have, and whether I'm referring them to a physician or whatever it is, or a neurologist, and try and work out the patient together and a joint. No. Just went onto this little black hole, came out with a vagina.
And this is presumably the case also if you're doing NHS and private work, with one not talking to the other, depending on the ideology.
When I worked at the NHS, it was all in the NHS. Now I work privately, it tends all to be private. The good thing about the NHS gender clinics is they do have a long waiting list. So that's the good thing. The worst thing about the private gender clinics, you go there and you get hormones on day one, and they say, well, you've been waiting so long anyway, so that's your real life test.
And the parents of these children, obviously we're now hearing more about parental trauma, and that they are primary victims, as well as, of course, trying to prevent further victimisation and harm and damage to their children. But they're being labelled as transphobic, homophobic, they're being labelled as bigots, as right-wing, as reactionary. Tell me a little bit about that, because obviously we're now hearing from parents facing this constantly. More and more are coming forward.
So if I compare it to other psychiatric disorders, so if you consider anorexia, there's a big similarity, because with anorexia, you have a mindset where I know what I need to lose weight. And then you've got those around them going, no, you don't, because you're really unwell. But then in anorexia, they have these little groupings, and they always find their little anorexic friends, and they all collude. And if you were ever to look at a pro-ana website, which they tried to ban, they have all this this information like, don't listen to your parents, don't listen to your friends, they'll always lie to you. But the difference is that in anorexia, most people around them aren't giving them what they want, whereas the gender clinics are basically doing the same as if you were to starve an anorexic. They're giving you what you want. It may not be what you need, but it's what you want, so you'll be happy. And why don't you follow them up? Oh, we've given them what they want. How do you know it's helped them in the long run? They're happy because we gave them what they want. And it's a bit bizarre that no one follows up. I mean, you have a finger operation, you'll have a long-term follow-up study. Why are we not following? This is the most biggest surgical overhaul you can do to someone. Would you not follow them up to see how they get along?
In terms of the comparison between anorexia and the trans industry, I have seen similarities with the many, many investigations I've done into the so-called grooming gangs in northern England and elsewhere, where working class white girls are groomed by, in particular circumstances, in particular towns, handsome Asian men.
Or often not handsome.
Well, yeah, once you go up the ladder, we're talking grotesque. But their first port of call is, of course, the handsome younger man in the car. And as soon as her parents start getting worried, he's telling her they're going to say not to see me because they're racist. Yeah. And they're going to say not to see me because you might have been drinking or smoking cannabis, but you love drinking and smoking cannabis, don't you? And it just hit me that was very similar.
But also society, because I'm a group analyst, I'm interested not just in the person, but the situation, the environment and the groupings that they're in. And it's very similar. So why was nobody looking into questioning or challenging these Rochdale child rape gangs? The idea that they could be considered racist if they, which is complete nonsense. Why are we not scrutinising castrating children? Oh, because you'd be transphobic. There's a direct parallel in societally why we're not doing what is sensible. Yes. And right in your face. Why didn't anyone question what Jimmy Savile was doing with all those patients? When it's right in your face and obvious, you don't question it. When I used to work at filtering offenders, and I saw these people who were just like, funding a £500 a day crack habit. And I was saying, how do you do that? And they're going, we just steal things and rob things all day. We just walk into places and walk out brazenly and nobody questions you. If you're looking dodgy and they'll question you, they just walk in, take something, or they just look normal. And that's what these people do. They're coming across like this is the normal thing to do, nobody question it. Whereas, those of us who can think normally and critically think, oh, hang on a minute.
But when the two journalists at the BBC at Newsnight did expose Jimmy Savile, and it was buried, and this was after he died, so obviously he was no longer abusing, but we knew the cover-up. There was a huge outcry, because as soon as that information contained in that investigation became public, we all understood what had been suppressed. But Polly Carmichael and lots of senior clinicians, government officials, members of parliament, judges, policymakers, they have been told repeatedly, this is harming children, this isn't helping children, there's no follow-up.
I went to see the medical director in 2002, 3 or 4, one of the years, and I went to go and see him, and I said, what on earth is happening? And I said how I thought this was medically, ethically all wrong, and he sat there smiling and didn't say anything. This was the medical director of the Tavistock, with this smug look on his face, this sort of, I'm a clever analyst, smiling. And I thought, this is outrageous. You can't even bother to say anything. That was it.
So when were you first called transphobic?
Oh, 2000. Yeah. But never by a patient. None of my patients who've ever been in treatment with me have ever had a problem with me. The people who had problems with me have either not seen me professionally or don't know anything about me. They just know that I treat people with gender dysphoria. I mean, I remember that once, if you Googled me, there were 13 pages of Google about how I was the most evil, dangerous, transphobic, homophobic psychiatrist in the world. And the 13th page was in different languages. It was quite an accolade. And my patients at the Portman, my therapist was going, what's all this about? What? You seem quite nice. Okay, well, I think I am. But it was just this autistic sort of rage.
Did it ever really personally offend you, the homophobia at the root of this ideology, and coupled with working in a homophobic environment? I mean, I don't think any gay or lesbian kid growing up has always had, the best time possible, either today or 50 years ago. But how did you cope with that, and then being called transphobic?
I think my own history is on living on the fence of inclusion exclusion. When I trained as a group analyst, my final leaving paper that you have to do was about being on the border of inclusion and exclusion. I grew up in the 1970s in North Wales as the only brown family, so I was used to not being in, not being out. And so being in a clinic which seemed to be stuck in 1920, very homophobic, it was just, it was another thing. You just know what's right in your head, and the best advice I got from one of my trainers, the wonderful Estella Weldon, who is very well known, she said, when I started the Portman, she said, you're going to spend the next 5 years or so dealing with the worst aspects of society, because you're dealing with prisons, Broadmoor, murderers, paedophiles. She said, the most important thing for you to do is have a life outside of the work. She said, you need to leave work and do something very nice that's very different and very lovely, because you're spending your time in prisons, in high secure hospitals, talking to murderers. So the idea was you go into these places as a sense of a visitor rather than becoming the institution. So at the Portman Clinic, the task was to be there and also not be there. So you have to develop a semi-permeable membrane that you can take things in and not become it.
What's the future for your profession, for psychiatry, for any of the surrounding professions that deal with gender, as they call it?
What I found is that the only psychiatrists that really believe in affirmation or gender ideology woo are people that work in gender clinics. I don't know a single psychiatrist who doesn't agree with what I think. And all my colleagues say, thank you for speaking out, you're speaking sense, somebody needs to do it. They're often too scared to put their head above the parapet. But what's annoying is our own college, the Royal College of Psychiatrists, have this ridiculous gender affirmatory, non-critical thinking, anti-biology understanding of gender identity. And a load of us had a meeting with them and said, can you at least survey the members to see what their views are rather than telling us what we think, because we don't think that. And they refused to do it. So you've got this little cabal in the Royal College of Psychiatrists who are completely captured, who then put out a statement as to what psychiatry believes, which none of us believe, but they won't bother to check it with us because they know we won't. So I have no qualms about what psychiatrists think, because they all actually think like we think. But it's just the captured few who also no psychiatrist wants to go near anyone with gender dysphoria with a barge pole, so because they're so scared of being transphobic or whatever it is. So they're left to the gender identity clinics who just do their own thing.
Well, now that Cass has been published and there's been the hoo-ha around it? Is that it? Is that the end? Are we going to see closures of gender clinics?
I hope so, but probably not though, because it's wonderful seeing the effect of the Cass report, because those of us who have always agreed with everything she said anyway thought, hurrah. And then those people who were, brave enough to realise that their position has been wrong have then gone about face and openly said that. So you've seen that in that wonderful day in the House of Commons where they discussed this, and certain people that we all know said, actually, I realise now that I was... But then you've got the stalwart people who still will refuse to, and think, gosh, and it reminds me of, I've had patients who've left cults, and they talk about how difficult it is not only to physically leave a cult, but to mentally leave the cult think. And I often say to my depressed patients that depression is like a cult, because when you have someone that's spouting stuff to try and convince, like the man in Oxford Circus who always says, if you're not a winner, you're a sinner. We walk past going, oh yes, just ignore him, he's talking nonsense. But when you've got your own brain saying everything's negative, everything's bleak, everything's hopeless, and it's coming from your own brain, then you get sucked in. And I say depression is like a cult, because your onboard computer's been corrupted and you're believing all this stuff that you wouldn't believe if you weren't depressed. So on a societal level, you've got these people who are complete cult members of the gender cult, and they're proving not to be amenable to all the evidence that is in the face of what they think. But it's almost like they're too stubborn to admit they were wrong. I'm just waiting for all those horrors that were in the Harry Potter to realise that all their protestations were ridiculous, but I wonder how stubborn they'll be.
You've been listening to Julie in Genderland. The whole series is available to download now, wherever you get your podcasts. Please listen, like and share.